everybody. Okay, hold on a minute. Okay, I think that's it. Hello, everybody. So I thank Carly and the group of Hope and Cope for having me here one more time. I really like these chats and I really like the opportunity to give you a little bit of basic knowledge on nutrition, general, especially related with your diagnosis that you're living through at this point. Like Carly said, I'm gonna just do my presentation. You can ask all the questions at the end. I usually try to say or express every question that I have been asked before. Usually questions repeat itself often, but don't be shy if you wanna ask something in particular. My name is Yamileth Marcano, and I'm a nutritionist working at the U.S. General Hospital. I do have a lot of experience. I've been working for over 4 years in oncology patients. And right now, my mandate at the Jewish is mostly with hemato-oncology patients. However, I do have experience as well. I've been working with Carly for a while now with Hope and Cope. And I also work with the breast cancer clinic at the McGill University Health Center. So that's me. And I'm just gonna start right now. Oops, okay, hold on a minute. Okay, so I always like to start my chats clarifying that your diet or a specific food, it has never been directly related with a cancer diagnosis. So usually when we get this diagnosis, we always try to think back, or patients try to think back, is it something that I did wrong? Did I get a cancer diagnosis, or I'm getting cancer just because my lifestyle wasn't the right one? Do I have to do, like, there's something I could have done better to not have this diagnosis? And the question or the answer to that question is basically most likely no. There's nothing you can have changed in order to have, or diet wise, in order to have that diagnosis. There's no food or not food item directly related with a cancer diagnosis. However, there's some food related or health lifestyle related facts that it has been directly like, or given a relation or directed risk with increasing your chances of having cancer. Increased chance doesn't mean necessarily that it's going to happen. There's a lot of people that they follow a unhealthy lifestyle and they never go to a diagnosis. And there's a lot of people also who does have very good habits and they do end up with a diagnosis. However, we want to always take the preventive side, and that's what nutrition does. It does prevent for you to have a diagnosis. And in the case now that you already have a diagnosis, it might prevent you for having a new recurrence once your cancer is going to be cured and healed after your treatment. So in terms of diet related or healthy lifestyle related facts that it has been related specifically to breast cancer, we have these 4 items or pictures here. So the first that it has been noticed is that people who is overweight or they have an excess in weight. And when I talk overweight, usually we define overweight just by a simple relationship between the height and the weight. And there's normal values. So this is how we define overweight, with a body mass index over 25. Those people have been directly related with an increased risk of any types of cancer, and particularly breast cancer. However, nowadays we know that if you have a little bit of extra weight in relationship to your height, but that extra weight is mostly from muscle mass, the risk decreases significantly. So really the high risk or the risk related with a diagnosis of breast cancer is when we're talking that we are overweight, and that overweight counts of fatty mass or adipose tissue, really like the fatty cells. So that it has been noticed to be related with increased risk of a cancer diagnosis. The second factor related to food that it has been related is what we call saturated fat. So what are saturated fat? Saturated fat, basically the saturated name comes from a chemical characteristic, but usually those are fats that we find in animal products. It could be dairy products, it could be meat, it could be chicken, it could be eggs, like everything that comes from animal sources has saturated fat. And also is the same as chemically or in the body is the same thing when we talk about vegetable fat who has been processed or submitted to high temperatures, and they change their configuration, their original configuration. This is what we call trans fats. And in the body, in the organism, they do have pretty much the same effect. So if, for example, like high fat dairy products, that would count as saturated fat. However, low fat or not skimmed dairy products, it wouldn't be the same case. The third factor that it has been related directly with an increased risk of breast cancer is alcohol consumption. When we talk about alcohol consumption, it's very tricky because it's actually part of some recommendations for healthy brain diet or Mediterranean diet. However, there's a quantity that we recommend. So we recommend usually for a woman or for a woman to have maximum 2 servings of alcohol per day. And when we say 2 servings, we usually make emphasis in trying to encourage that serving is red wine. And the only reason the red wine is better than the other kind of alcohol is just because it has antioxidants, the polyphenols properties that might fight or might reverse a little bit of inflammation. When we do this recommendation, or when we say that we recommend 2 servings per day, it doesn't mean that you have to have it. We don't recommend anybody who doesn't drink alcohol just to add alcohol to have that protective effect, because that protective effect, we can get it from other kind of food as well. And the other thing is that is the effect or the recommendations are not accumulative, meaning that if you don't take 2 glasses of wine a day, for all week, it doesn't mean that you're like Saturday, you're gonna have 10 glasses a day. So the effect doesn't accumulate. It's really calculated by servings per day. And the fourth and last factor that it has been related is not necessarily nutrition, but it's related with healthy lifestyle, is physical activity. So we know when we do physical activity, we promote an increase in muscle mass. Muscle mass, it has been related with decreased inflammation, and also muscle mass when it's actively working, it has been proved that it produces substances that they're gonna fight inflammation, and therefore they're probably gonna be working in favor to avoid the development of malignant or abnormal cells. So if we see all of these factors, it's hard to say, is it just because one factor isolated has been related to increased risk of breast cancer? Or if you see, let's say you eat a lot of saturated fat, you're sedentary and you don't do physical activity, and you have a high consumption of alcohol, you're gonna get overweight. So what is the first factor that intervenes? We don't know, probably is a mix of everything. But again, there's no a single food item that has been related, like if I eat this, I'm gonna get cancer. So it's always increased risk, doesn't mean that necessarily is gonna happen. There's a few factors, environmental factors, genetic factors that plays a role into a cancer diagnosis. So when we talk about what is best for me to eat when I'm having a cancer diagnosis. So basically, there's no difference from any other diet. that we recommend. We recommend, in the first place, a diet according to the Canadian Food Guide. It sounds a very cliche, but honestly, the new Canadian Food Guide has explained in a very simple way what we dietitians have been trying to explain for over years. So basically, in a healthy diet, if you see the plate or the image that is presented, you're gonna see a full plate where half of the plate we're talking about fruit and vegetables, a quarter of the plate we're talking about protein sources, and quarter of the plate we're talking about any kind of grains of cereals or starches, as we better know them. So this plate, it sounds very cliche, but it does have a scientific work into it. So when we talk about specifically healthy diet and decreasing the risk of cancer diagnosis, and again, you might say like, well, this is a decreased risk, I already have a diagnosis. It does also work, and it also gonna decrease the risk of a new recurrence. And if you're eating properly, you have higher chances for the cancer to disappear and have a better tolerance to any kind of treatment. So when we talk specifically about breast cancer, what it has been proven in the literature or in all the researches is a plant-based diet decrease the risk of cancer. And I'm going to explain a little bit more what is a plant-based diet. But basically, everything that is not refined or not produced in industry, everything that is natural food, again, decreasing the quantity of animal products doesn't mean that you have to be vegetarian. It's just try to consciously try to include a little bit more of less animal food and more vegetarian sources. So that it has been proved to decrease the risk, not just cancer, any chronic diseases. We're talking about diabetes, we're talking about hypertension, we're talking about cardiovascular diseases, we're talking about cancer. If you see the plate that is on the Canadian Food Guide, you can clearly see that we make an emphasis in everything that is fruit and vegetables. So another fact that it has been, or another food item that has been related with an increased cancer, and then it has been a specific, all of the research about red meats and cold cuts, it has been very, very specific to colon cancer. However, these recommendations were translated into all kind of cancers just to avoid any increased risk. And when we say red meats, again, I'm going to explain a little bit more into what does it translate into food, but we're talking about everything that comes from like beef, it could be like veal, it could be goat, and when we say the cold cuts, we're talking about all the charcuterie. And basically, this is caused by the nitrites that these food, when they go to industry, they include the nitrites just to do the food preservation. So this is basically, like I said, it has been related with colon cancer, but we do take it as a recommendation in general cancer population. A diet high in fiber, whole grains, beans, fruit, and vegetables. So we know that usually when we eat refined starches or refined cereals or refined carbohydrates, as you better know, we usually have a response in our body that is going to be just because we use that sugar that this type of foods produces. We use it along with the insulin. The insulin we have to produce in order to use this sugar. And they use insulin when it comes high in our body. It is a growth hormone. So usually it's related, when we have a lot of insulin running into our body, is related with higher inflammation, is related with higher capacity of storing fat products or fat, increasing fat storages. So what we try to do with the high fiber diet is just to try to regulate that the absorption, just because the fiber doesn't absorb, the absorption curve is not going to be high, it's going to be steady. And the production of insulin is not going to be high, it's going to be steady. So metabolically speaking, the high fiber items or the high fiber food items usually help to have a decreased inflammation in our body. When we talk about omega-3, again, a diet rich in omega-3, same thing, omega-3 we consider an antioxidant. So it's just gonna protect of all the what we call free radicals. That is just substances that when we metabolize in the body, substances that stay flying there in our body. So omega-3 is just gonna catch them for them to avoid and harming our body. Hydration is very important, especially if you're having any kind of treatment. Our body is 70% water. And when I say hydration, it doesn't mean just water. You can hydrate yourself with any kind of liquids. It could be, when I say hydration, that counts with soups, coffee, tea. If you're taking any kind of juices or any kind of beverage counts. Particularly when we're talking about breast cancer, then we have these all myth about soy products. So we used to believe that when a cancer is positive for hormone receptor or estrogen receptor, in the past we used to eliminate soy products from the body because we know that soy products, flax seeds, chia seeds, they give us a little bit of estrogens. However, nowadays we know that those are vegetable estrogens, what we call phytoestrogen, and they act in our body differently than the actual estrogens coming from animal sources. That is the one that we produce, the hormone that we produce. So they do have different receptors on the body. So increasing or having a regular consumption of soy products, flaxseed, chia seeds, is not going to have any impact in an increased risk of having a cancer or an increased risk of having a recurrence. So what's the actual recommendation? The actual recommendation is that you can have soya products, tofu, soy milk, edamame, as a normal person, meaning 2 or 3 portions every day. And in fact, like a lot of researchers now are saying that if we consume or we introduce soy products since we're kids, since childhood, we do have a special or an extra effective protection against breast cancer, because they're gonna saturate the regular phytoestrogen receptors, and they're gonna uptake also the receptors that we have for the estrogen that we produce. So we do have an extra protective effect. However, this effect hasn't been seen when we start using soy products in when we're adults. So if you don't eat soy products, you don't have to add them to your regular diet. But if you do and you're just avoiding them because you think that it might increase your risk of a recurrence, you don't need to. You can just go back to take soy products as you're used to. As I said before, alcohol, it has been related directly with an increased risk of breast cancer. So of course, we want to just be prudent or avoid to have alcohol in excess. As well, when we talk about alcohol or when we talk about cancer or breast cancer, all of the treatments that are meant to be to heal or that you're going to go through, either hormone therapy, either chemotherapy, either radiotherapy, the 3 of them, they increase the risk of osteoporosis. So for different methods, but they you have a higher risk of having bone fractures. So usually alcohol has 2 effects. The first one is that if you drink too much alcohol and you get drunk, you might have just issues with your balance, and you can just have your higher risk of falls and your higher risk as well of fracturing any kind of bones. But also the alcohol decreases the absorption of the calcium when we drink, decreases the absorption and avoids the deposits of calcium in the body. So we're using less the calcium that we need to protect the bones. So just be prudent and try to moderate the quantity of alcohol that you drink. And the same thing for exercise. It's part of a healthy diet, as I explained before. just the exercise keeps you in a healthy way, and as well keeps your muscle mass in a good state, so we can have anti-inflammatory substances protecting your body. But also the exercise, either aerobic or strength exercise, they're going to protect your bones as well. They're going to increase your bone density, so they're going to just prevent as well or decrease the risk of osteoporosis. So again, if we see here all of the recommendations and we translate this into my healthy plate according to the Canadian Food Guide that we have here. So there's a few reasons why this plate, it is what we recommend. So if you see half of the plate, you have first, you have what we call lower density food items. That means that in big quantities, they give you low calories or little calories. So you have that in the fruit and the vegetables, and what are they going to do, or what is going to be the consequences? If you increase your vegetable consumption, probably you're going to be have full satiety or be satiety after meals for longer time, because those are high fiber, they absorb slowly, and you're not going to feel the hunger sensation as fast. You're going to have low calorie products, so probably it's a good strategy to maintain your weight, and if you're a little bit overweight, even to it might encourage a little bit of weight loss. And you have a lot of antioxidants, so vitamins, minerals, that is going to protect you from again, free radicals or things in your body, and it's going to avoid any deficiency. So that, if we're talking about the vegetables, then when we go a quarter of the protein sources, if you see, we have a lot of plant-based, it could be beans, it could be tofu, it could be nuts. And we also have the regular, like I said, plant-based diet. Doesn't mean that you have to become a vegetarian. This is not a recommendation. It's just to reduce a little bit the intake of animal products. Let's say aim for one vegetarian meal either a day or maybe just once or twice a week. So that way you're going to automatically by default decrease a little bit of animal consumption. And then you have protein as well. If you have a decent amount of protein, like we recommend, like around a quarter of your plate, it's also a macronutrient that is harder to digest, so it's going to continue with keeping the satiety for a longer time. And if you see here, the starches, they are less refined, they're whole wheat. Again, you're going to control the portion, you're going to have the full satiety, and you're going to have the effect anti-inflammatory or the fiber that is going to absorb slow, and you're going to have less inflammation in your body. And this way as well, like again, if you're overweight, you can control a little bit or maybe reduce a little bit the weight. So a little bit, how does it translate all these recommendations? What kind of food, what food items should I include? So we see, if we're talking about a plant-based diet, again, as I explained before, minimal amounts of processed food, limit animal products, and focus on vegetable, fruits, whole grain, legumes or beans, seeds and nuts. We try to avoid refined foods like added sugar, white flour, and processed oils. So this is basically what is called a plant-based diet. I usually recommend, if you're gonna go to groceries, just stay in the corners, depending on which grocery store you go, but just try to go, avoid all of the preserved food, refined food. Just go more into the aisle where you have all of the natural and fresh food that you can just prepare at home. So I think this, I'm sorry, I just switched. So this is not the high fiber, this is the protein sources. So where do I find the protein sources? Protein sources, I am gonna find beef, lamb, pork, veal. Oh, sorry, this is not even protein sources. This is, it was a mixed up. Red meats and cold cuts. Where do I find or what it does translate into food? Beef, lamb, pork, veal, goat, deer, all of those are red meats. And then the cold cuts, deli meat, ham, sausages, hot dog, wieners, bacon, You just have to try to, we always recommend for a healthy diet, just start reading labels, comparing food items so you can see the qualities of the food. Sometimes the same kind of food, it has different qualities or different ingredients. And basically what is has been related to cancer is the nitrates. So just go for sodium or potassium nitrates. If you see it as an ingredient, try to stay away. And everything that is smoked or cured is going to be as well considered as a cold cut, or is going to be considered as a high content of nitrates. So this is what you try to stay away from. So yeah, so I don't know why all of my writings are really like mixed. This is not omega-3, this is high fiber. Where do I find the fiber? It could be oats flakes, it could be barley, brown rice, quinoa, whole wheat, full items, either bread, either bagel, either muffin. So just try to go for whole wheat pasta. Now we have in the grocery store so many pastas that are not even made of wheat. They're made of other kind of cereals like quinoa, sorghum, orge, so or barley. So you can go in those. Usually they have a little bit more fiber than the regular white pasta. Fruit and vegetables, nuts and seeds, pumpkin, chia, flax, sunflower, sesame seeds, bean, chickpea, soybean, lentils. So and you're gonna see some overlapping into all my recommendations again, because again, healthy diet, it is what it is. It overlaps, and there's a reason for it, as I explained. So when we're talking about omega-3, you can find in any fatty fishes, salmon, mackerel, anchovies, sardines, trout. You can find in eggs, flax, chia seeds, walnut, soybeans, tofu, canola oil. Those are the higher, but you can also find some omega-3 in avocado or olive oil, and even in the regular avocado and any other nuts. And I put here protein sources. I haven't gone there, but I told you protein is very important to try to maintain your muscle mass. I'm going to talk a little bit more about treatments when you're going specifically for radiotherapy, chemotherapy. Those are medications that are very, very strong. They destroy, and they're meant to destroy your abnormal cells, but unfortunately they also go with that destroying some normal cells. So what we want you is during treatment, even if you're having surgery, it applies as well, is that you have enough nutrients just to reproduce, resynthesize, rebuild all these tissues that were destroying. So we want to make sure that we have a diet that is sufficient in protein sources. And we usually recommend to make sure that you add a protein source every time you eat. Either meat, either poultry, either fish, either egg, tofu, milk, cheese. Greek yogurt is very high in protein. And then we have things that have a little bit of protein in a little bit less quantity, like beans, nuts, any kind of almond butter, peanut butter, any butter coming from nuts, regular yogurts, and grain and cereals. What about my bone health? Again, as I said before, usually what happened with all of the three of the treatments that we have available, hormone therapy, radiotherapy, chemotherapy, what happened usually regular in our bones, and then we have like a balance. We have the osteoclast, or they are like the cells that are exiting, and the osteoblasts are the cells that are coming in. So it's a cycle all the time. We have new cells, then they're destroyed. New cells, destroy. New cell, destroys. And that makes the bone tissue functioning. So what happens with all of those treatments is that they're going to decrease the production of the new cells, which is the osteoblast, as you see it there. So you're going to have less production of new cells, and you're going to have an increase in destroyal of those cells. So that's why your bone density might decrease, and that's why the risk of osteoporosis is increased. If you have, you are like over 50, that you're already into menopause, you're going to have even higher increased risk. And if you have any kind of genetics or family history of osteoporosis, you're going to have even increased risk. So those are factors that you have to take in account just to avoid, like I said, any kind of fractures or any kind of decrease in bone density. And as I mentioned before, exercise is one of the therapies that we do. Reducing alcohol consumption, not just because if you drink too much, you're higher risk of fall and fractures, just because the absorption doesn't happen. So you put more calcium into your urine. You just get rid of it in the body. And the other thing is the diet, or that diet to be sufficient to give you vitamin D and calcium. If you don't have a diet that is enough in vitamin D and calcium, so which food should I be looking for if I want to have a high calcium diet and vitamin D? Is basically dairy products, dark or green, like dark green vegetables like broccoli. It could be kale. It could be not cauliflower, the chou de Bruxelles or Brussels sprouts. It has to be dark green. You have as well eggs. You have fatty fishes as well, vitamin D. But if you're not eating any of these food items, or it could be also drinks that are they have supplements in vitamin D, they're fortified. But if you're not having any of these items, you should consider asking for a prescription for supplementation. Usually for any cancer patient that is receiving treatment, and also is the same recommendations that when you're after 50, your requirements, vitamin D and calcium, they increase. So for calcium, you need 1,200 milligrams of calcium per day, and you need 800 international units of vitamin D per day. Usually when you take calcium supplementation, it's 500 milligrams, and you can have it 2 or 3 times a day, depending on your intake. And vitamin D, if you have a prescription from the doctor, they give you just 1 doses of 10,000 units every week, or it could be 1,000 units daily. So what about if I'm going under treatment? I know a lot of you that you haven't started treatment, or you are already past that stage. I just want to I'm not going to talk about treatment. And the only reason that I'm not going to talk in deep about treatment is because if you're having any concerns regarding your nutrition while you're having treatment or while you're having your diagnosis, you should definitely consult a dietitian. There's usually a dietitian in every oncology clinic. If you're going to the public system, there's private dietitians, but you should have available a dietitian in the public system. And if you have more specific questions, just go and ask for one. But just to say, like for every other treatment, we recommend a healthy eating, specifically things for every treatment. If you're going hormone therapy, secondary effects is again because we are suppressing the production of estrogens. What happens with estrogens is that they usually when we don't have it, we have a tendency to accumulate more fat storage. So fat storage, metabolically speaking, is less active than muscle mass. So if we reduce our muscle mass and we have more fat storage, we have a high tendency of to gain weight. So hormone therapy, just healthy eating, try to stay active is very important if you don't want to gain weight. For radiotherapy, focus really on obviously healthy eating, but hydration. Again, we're giving you toxins, so we want you to get rid of those toxins as soon as we can. So the idea is to increase your urine output so you can just urine all of the toxins coming from the radiotherapy. So just make sure you're very well hydrated. Usually radiotherapy doesn't have any secondary effects on your intake. It's very, like nowadays with the technology, is very local. You don't have any difficulties. You might just feel an increased fatigue or tiredness, but it doesn't have much of an impact in the nutrition. The important thing to consider is you have to stay away from natural products because they might interact with the treatment, and any kind of antioxidants that you take in mega doses. So everything that you eat is okay. If you eat a lot of vegetables, a lot of fruits, a lot of omega-3 containing food, that's fine, because those are small doses or adequate doses that are going to protect your body. But if you're having antioxidants, just because, again, we're trying to oxidate with the treatment, they might interact. So just anything with vitamin C, vitamin A, vitamin E, omega-3, zinc, don't take any kind of supplements. Other supplements like vitamin D, calcium, and B group are okay. Those are no antioxidants. And chemotherapy, I would say, is the most touch concerning the nutrition. Again, we try to keep a healthy eating while we can, and then I'll explain a little bit when I say while we can. Same thing with the radiotherapy, avoid natural products, supplements with antioxidants. And if you have any symptoms affecting intake, just ask for a dietitian. So usually with the chemotherapy, important to remember, what are those symptoms that keeps you away from eating? Usually they come with secondary effect, nausea, vomiting, diarrhea, or constipation, mouth sores, and a lot of fatigue that is leading to a decreased appetite. So again, if you're having any of those, go to a dietitian. But things to remember is food becomes a medication, not a pleasure. We're usually used to link or have the feeling that food is just pleasure. I eat because I like it and I enjoy the food. But we forget to remember that food keeps us alive. So if we don't eat, our body doesn't function very well. So when you're having a lot of symptoms, where you're feeling tired, when you're feeling sick, of course, you don't want your appetite is decreased. But remember, you need this to recover. We need to make sure that you have all the nutrients to stimulate the healing process. So what do? You try to go smaller meals, but more often. Every 2 hours, you take a little bit of a snack. What's the key to that? Add a protein source every time. Again, I told you that protein sources are very important to keep your muscle mass. Also, when you're tired, you're having chemotherapy, probably your mobilization and your routine is decreased because you're more in bed. So the high risk of losing your muscle or the risk of losing your muscles is very high. So make sure you have enough protein. Try to stay as active as you can. And it's not something that I recommend like as an entry point, but if really intake is very bad and you cannot compensate with natural food, adding small meals more often, nutrition supplements always help. It's a lot of sugar, it is, but it's also a lot of calories and they have protein. So I'm not paying for anything, but just to name brands that we use in the hospital, Ensure, Boost. You can go with the no names from the pharmacy or the grocery stores. There's no problem. You have to make sure that it has enough calories and proteins, and you use it as a supplement. It doesn't replace the food. It's just gonna, if you're not eating enough, it's just gonna give you a little bit extra. And that's pretty much it.
Yamileth, thank you so much. It's always such a pleasure to have you. There was one question that was asked earlier on in the chat that says, what about the HER2 or HER2 protein and probiotics? What do you know about those two things?
So the probiotics, I mean, there's nothing related with the H2 or that's pretty much the hormone receptors. So there's nothing to do with that. The only issue with probiotics is that if you're having chemotherapy, I didn't mention there because that's another big subject. But usually when you're having chemotherapy, your immune system is decreased or it's not working properly. So we don't recommend probiotics because your body doesn't have the defense to act against any kind of exterior microorganism. So, for example, yogurt, they do have alive or culture bacteria, so those are fine. But the probiotics are extra living bugs or living microorganisms, as you wish. So just during chemotherapy, we don't recommend to have probiotics. After chemotherapy, there's no contraindications, so you can have probiotics as you wish. Especially if you're having issues with bowel movement, radiotherapy, and hormone therapy, there's absolutely no contraindication to have the probiotics.
Perfect, thank you. I just want to invite, I don't see any more questions in the chat, so I do want to invite anyone who does have a question to ask it now in the chat, please. Wait a minute. You can also unmute your microphone and ask it out loud if you like, but as I mentioned before, this meeting is being recorded. Oh, here, another question. What about sugar? Should we take it out from the diet altogether? What about sugar in fruits?
Okay, so I mean, sugar, it's not recommended to take it out of the diet altogether, and I explained why. We have different type of sugars. We have what we call in more medical or nutrition terms that sugar are carbohydrates. We have the carbohydrates that absorb easily, where the regular sugar that we know, the white sugar, the grain sugar that we know comes in, and carbohydrates that absorb slowly. Those are the ones that I told you, all the whole wheat grains, non-refined. So added sugar, as we know, in like honey, it could be honey, it could be syrup, it could be brown sugar, it could be like the regular white sugar. Those kind of sugars we don't need, as long as we're having enough of the low absorption sugars. The sugar from the fruits, yes, they are kind of sugars that they absorb quickly, but the fruits have, like when you don't convert the fruit into a juice, when you keep the fruits like in an original form, like a fresh fruit or a whole fruit, you have as well the fiber in there. So usually that sugar is going to absorb slowly because you have the fiber. So you don't have to remove fruits from your diet. You just have to portion control. So enough carbohydrates to have for your body to function properly without overdoing it. So usually, I mean, it's very individual, but usually the recommendation stays between 3 and 5 portions of fruits a day. And when I say portion, usually it's one either medium-sized whole fruit or a cup of, if you're gonna cut some kind of fruit. Again, it's very individual, but you don't need, for example, if we're talking about desserts, if we're talking about the sugar that you add, if you're talking about, you don't need them. It's very hard. Like if you see food labeling for all of the processed food that we buy, and that does not necessarily that because you buy frozen food, but for example, if you buy like breakfast cereal or simple things, like maybe ingredients when you're going to do a preparation, you can see that most of them, they have a little bit of sugar. That doesn't mean necessarily that they have added sugar. It could be the natural sugar from the product. So natural sugars are fine. What we try to avoid is the added sugar. And again, when I say this, I said when we have like a good appetite, we're not having any difficulty with the treatment, we're eating well, we don't want to add extra sugar. But for example, when we have a chemotherapy patient that is having really, really hard time to find the pleasure to eat, they're tired, they having pain in the mouth, they having nausea, they having vomiting. So we do have patients or that they eat absolutely nothing during the day. So at this point, I don't care if they eat 3 spoons of white sugar, because I just want them to get some calories and some nutrients so the body can function well. So it depends on the context, but in a healthy diet, we don't need the added sugar.
Okay, I see another question here about, is grass-fed beef a good source of protein?
Is what? Sorry?
Grass-fed beef.
Yes, it's good. Any kind of beef is a good source of protein. Like any animal product is usually a good source of protein. When we talk about protein, it doesn't matter is this like beef, chicken, fish. Usually in a specific amount. Let's say in 1 ounce, all of them have the similar content of protein. And when we're talking they're grass fed, it is just gonna change. I mean, it's not gonna change the quantity of protein. It's gonna change the way the beef was grown, but the content of protein is gonna stay exactly the same.
Okay, perfect. Now is your last chance to submit your questions in the chat. If you feel comfortable and are okay with your face being on the recording, please feel free to unmute your microphone and ask it out loud if you like.
I'm seeing another one. It says, how many times after chemo we can have antioxidants? Usually we recommended at least 2 weeks pre and post chemo. We don't recommend you take any natural products or any supplementation, vitamins or minor mineral supplementation. 2 weeks is good enough.
I think that's it, unless anybody else has gotten any questions directed to them specifically. We can end it here. Yamileth, thank you so much for being with us. It's always such a pleasure to have you.
Thank you, everybody, for being here.
Yes, thank you. And for those of you who are part of the support group,